When it comes to deciding between life or death, to some people, their beliefs and values become the first priority. In a country in which people abide by their tribes, their respect to their culture is more important than their medical needs. For many tribes spread across the globe, there is a set list of customs to follow in order to cure the ill and keep relatives healthy. The ethnic groups supply themselves with their own medicine. When it comes to something incurable, they are in a position to make a hard decision. For a person to deny the treatment of a doctor seems irrational, but to these people, they believe the opposite. It becomes an overbearing question. Will spiritual medicine or scientific medicine elongate the life of a loved one? Spiritual medicine is a healing technique that cultures abide by, whereas scientific medicine is using prescriptions and procedures to heal and cure patients. Hospitals only ever practice with experimental treatment. This is why cultured tribes rely on their own communities to partake in rituals rather than attending a professional healthcare facility. Many traditional tribes do not seek medical attention from the American healthcare system because of their spiritual medicines. When an American healthcare facility is exposed to a person with beliefs such as these, the illness and appropriate forms of treatment are difficult to acquire. A patient's cultural background can interfere with the scientific medical treatments. In fact, the spiritual medications used prior to arriving to the hospital may cause unknown reactions to scientific medicine. Would the hospital now respect other cultures? Will the barriers break once they see the pain that they are causing on the patients and family? Hospitals face cultural and linguistic hardships every day. Spiritual medicine should be accepted just as much as scientific medicine. It is not a witness or doctor's business to tell this family what their child needs unless they ask. In a world where this problem did not exist, every patient would be welcomed into the hospital and treated the way they want to be. But cultural barriers are preventing a harmony. This can change if healthcare workers were provided with information during their years of schooling about the different cultures that they will be treating prior to starting in a professional workplace. Kate Singleton, a master in social work, says, nursing literature offers minimal help in integrating cultural and linguistic considerations into nursing efforts to address patient health literacy. In other words, nurses are never taught about the different practices of people around the world. And the same goes for doctors, physicians, and surgeons. There have not been any efforts to improve this dilemma, but much can be done. If the doctors and nurses were aware of their many different beliefs and practices, then the different tribes would feel much more comfortable admitting themselves to American healthcare. A person's cultural background can be respected by all if it is looked at with an open mind. The shared beliefs are taught to that region to be passed on between generations. Each and every person has their own beliefs and therefore should be accepting of other people's rather than trying to convert them to your own. If people took the time to practice self-awareness and increase their knowledge of others, many cultures could live in harmony. Looking specifically in a hospital setting, medical staff members should do their best to remove cultural barriers by learning what their patients want rather than implementing the treatments into them. Respect begins with you. Medical professionals must put an end to forced treatment and accept the values of their patients.